Joining me today is Kendra Hamilton of Eat Squat Come. She is a somatic sex therapist, and I'm really happy to talk with you today.
Wonderful. I'm really happy to be here. Thanks for inviting me.
Thank you. So, Kendra, I was watching one of your videos and super informative, especially from a guy's perspective and it was specifically about the G zone, as you call it.
Mm-hmm.
And there's a tissue there, an erectile tissue that goes around the urethra, which, again, super fascinating.
Mm-hmm.
But you said something very specific that I thought was really important, which was that the tissue itself can hold trauma.
Mm-hmm.
And I think that it's something that a lot of people don't really know about or acknowledge, is that the tissues of our bodies can actually hold trauma. So I'm curious, what's the nature of the trauma that would be stuck in that kind of tissue?
In my experience with the clients that I've worked with, and also most of the anecdotal evidence, as well as my own experience, it's sexual abuse is generally held in the pelvic region. Even shame and negative sexual messaging encodes on the body in a similar way to an actual physical assault.
Is the trauma specifically held in that erectile tissue that was mentioned, or is it in the general swath of that area?
If there is pain or tension and holding and trauma being stored here, I think we just notice it more because there could be trauma stored in any of the tissue, and I've seen it stored in like lots of different tissues like the cervix, or lots of women experience numbness and pain around the entrance to the vagina as well. But because that tissue specifically is supposed to expand so much and then contract, if there is holding there, it's very, very noticeable.
When I think of trauma being held, it would make sense to me if it's something muscular, like the tissue being held or contracted by the nervous system, pulling tension on the muscle. But erectile tissue and the other soft tissue in that area, how is it held or constricted?
Yeah, I guess when I say tension, it's definitely much more about like muscles, and muscles hold like a ton because they are the things that contract in our fear response. So when we are in a traumatizing situation, those are the things that will contract and hold, and often they don't let go. And every single cell in our body has the capacity to hold on to an emotional wounding or hurt of some sort. So just because it's not a muscular tension, there can still be other types of pain that would indicate, an emotional or a traumatic holding.
Yeah. So one of the things that I noticed for myself was that I had this pain kind of under the line of my ribs in my abdomen. And I was talking to a guy who I was getting shiatsu from. I told him I have pain there. He goes, that's it's common, not normal. And what he meant by that was that a lot of people have tension in the diaphragm area, but it's not supposed to be there. So the question is about, for women, if you're experiencing pain in a particular part, how would you know that it's, that pain is not supposed to be there?
Well, I'm not a doctor, so I want to be a little bit careful about exactly how I answer. And I want to say, pain is your body telling you that something is wrong. It's telling you that there's something off and there's something that you need to be paying attention to. And if there is pain and if there's ever pain, I would say go to a doctor even if everybody else is experiencing it. If you're worried about it, or it's getting in the way of something that you want to be doing for yourself, or goals that you have for yourself sexually or personally, always go to a doctor and check it out just to be safe. And then if there's nothing that they say that is medically wrong, then it would be probably, then that's when you would start looking into what other, what sort of energetic or emotional or psychological or experiential things could I be holding in this area, and looking at it from that perspective.
What would be the next step at that point?
Definitely, if you can, if you have the ability and the funds to be able to work with a professional, that's always probably your best option. Somebody who does a type of somatic therapy, so there's lots of different types of somatic therapy, but someone who's licensed in like somatic experiencing is one, or sensory motor therapy, which combines sort of cognitive and body therapies, or somatic sex education. There are different professionals who can help. Somatic sex education is very specific to sexual abuse, to sexual trauma, and to working with genitals. They can do different like massage and genital de-armoring to help specifically work on releasing chronic pelvic tension, pelvic pain, and resolve like sex specific related issues.
What would be the maintenance? Like what's like preventative care maintenance?
A lot of it would, I call it body time. It's like giving yourself time to pay attention to your body realistically. And this is something where if you can't work with a professional, it would just be or you're not ready maybe to go and work with a professional. It's something that you can just do yourself at your own pace, because we are, as a culture, like we live in our heads and we value cognitive process and being productive and being logical and rational. And we really ignore a lot of the information that comes from our bodies. And our bodies are so wise and they talk to us all of the time. And so it's about giving yourself time to actually like listen to your body, especially when doing things in the genitals. It's like, don't push into it or drive it or try to force it. It's just about being like, okay, I'm noticing some pain, holding, pressing and holding, and breathing, like directing your breath right down into that. Imagine you're breathing right into your finger and expanding. And then as you release, sound. Like if you can sound, like that's letting go of like emotions, sounding, but any emotions that come up or any movement that happens. Like sometimes I'll do stuff like that and I'll start to get really frustrated and I'll want to scream or I'll want to shake or I'll want to roll around. Like just, it's like following your body's natural instinct and trying not to judge it. You might feel like a little bit nuts sometimes, but the more you do it, honestly, the easier it gets. So I would just be like, yeah, maintenance is just like body time. I actually take 20 minutes a day and I'll put on music. Sometimes the music has no lyrics. Sometimes it's all like hyper music and I feel like dancing. I'm just like, how do I feel right now? What do I want to do? And I just give myself 20 minutes to just be in my body. And sometimes I do more intense, like specific healing work where I'm like, I'm going to focus on something. I'm going to go into my G zone. I'm going to hold there if I'm feeling more tension or if I have had more pain come up, because just because you don't have pain one day doesn't mean that it doesn't come another time, you know? So sometimes I'm more focused and specific about being like, I want to breathe directly into my pelvis today and I want to look for pain there. And other times I'm like, I just want to be free and like not think about anything. So yeah, I would say at least 5 minutes just to start, but body time, just try to get out of your head, give yourself a break from thinking and judging yourself and worrying, and just be like, what does my body actually want to do right now? And yeah, follow its instincts, because it knows what it wants. Our bodies are smart, man. They know what they want. They know what they need.
Yeah. No, that's great. I think that's great advice. So I appreciate you joining me, and
yeah, my pleasure.